This video is a quick introduction to the proper positioning for a acute abdominal series, which includes a PHS, an erect abdomen, and a KUB examination. In order to successfully accomplish this acute abdominal series, you will start off with obtaining a PHS radiograph. In order to do this, you will start off with a 14 by 17 image receptor, which you will place within the wall bucky, either in a portrait or landscape based on body habitus. The wall bucky should be placed 72 inches away from the X-ray tube to form a 72-inch source to image distance. Let's go ahead and have our instructors demonstrate exactly how this radiograph should take place. Have the patient turn and face the wall bucky. Make sure that he or she places her chest against the wall bucky and rolls the shoulders forward. And make sure that the center ray is directed 7 to 8 inches below the vertebral prominence at the level of T7. Ensure that the patient's chin is raised and placed on top of the wall bucky. The patient's hands should be on the lower back of their hips with their palms out. The shoulders should be depressed down and rolled forward in order to get them away from the area of interest. The image receptor should be centered to the center ray, and the mid-sagittal plane should be aligned to the wall bucky with no angulation. A left letter marker should be placed within the light field in the upper left corner, and making sure that it is not within the area of interest. In order to successfully accomplish this examination, you will take the exposure on the second full inspiration. Therefore, you will tell the patient to breathe in, to breathe out, breathe in, and hold it. While the patient is holding their breath, you may go ahead and obtain the exposure, after which you will tell the patient to relax and breathe. At this point, you will enter the room and remove the image receptor from the wall bucky and process it in order to acquire the radiographic examination. Prior to taking the exposure, you want to make sure that you placed a lead shield apron in the posterior part of the patient's body, therefore it lays between the patient and the radiation source. Proper collimation should have been used in order to obtain the best radiograph with minimal overexposure. However, careful collimation should be taken into consideration in order to not crop off the area of interest. Now that we have successfully accomplished a chest view, we will go ahead and proceed to an erect abdomen examination. In order to achieve this, you'll be utilizing a 14 by 17 image receptor placed within the wall bucky portrait. The source to image distance should be 40 inches. Let's go ahead and have our instructors demonstrate this exam. With the patient standing upright, ensure that his or her legs are slightly spread apart and their back against the wall bucky. The arms should be placed at their side, and the mid-sagittal plane of the body should be centered to the midline of the wall bucky. The X-ray tube should be placed in a horizontal, and the center ray should be located about 2 inches above the level of the iliac crest, with the top of the image receptor at the axilla and aligned with the wall bucky and mid-sagittal plane. Adjust the height of the image receptor so that the center is approximately 2 inches above the iliac crest, which for the average person places the top of the image receptor approximately at the level of the axilla. You want to make sure that you align the mid-sagittal plane and center ray to the wall bucky with absolutely no angulation, and place a right marker at the bottom of the bucky out of the diaphragm. In order to successfully accomplish this, you're going to expose at the end of expiration. After you have taken the exposure while observing the patient, you may instruct the patient to breathe and relax. At this point, you may enter the room and remove the image receptor from the wall bucky and process it through the processor in order to acquire the radiographic image. This concludes the erect abdomen, and you are now ready for your next view. Now that we have successfully accomplished a chest and an erect abdomen radiograph, we are now ready to obtain our KUB. KUB stands for kidney, ureter, and bladder. In order to successfully accomplish this radiograph, we will start off with a 14 by 17 image receptor, which will be placed portrait within the table bucky and placed with a 40-inch source to image distance. Let's go ahead and have our instructors demonstrate how we would accomplish this examination. While our instructor places the cassette inside of the table bucky, we should inform you that we want to try to go ahead and have a lead shield placed on the patient radiosensitive area if able to. Due to the fact that this patient is a female, we are unable to shield her without obscuring the part in question. Start with the patient laying on the table supine with the mid-sagittal plane centered to the midline of the table and midline to the image receptor. The patient's arms should be placed at the patient's side away from the body. The legs should be bent with support under the knees in order to lessen lordotic lumbar curvature. The center ray should be perpendicular and directed to the center of the image receptor at the level of the iliac crest. The right letter marker should have been used within the light field, making sure that it's not in the anatomy of interest. In order to make this exposure, you're going to make sure that it is taken at the end of expiration, allowing about 1 second delay after the expiration to allow involuntary motion of the bowel to cease. Once that has happened and you've taken the exposure while observing the patient, you may instruct the patient to relax and breathe normal. You may at this point enter the room and remove the image receptor from the table bucky and process it through the processor in order to acquire the radiographic image. At this point, you have successfully accomplished an acute abdominal series. Let's go ahead and see what each one of these images should have looked like in a radiograph. Here we have a chest in a PA view. You should be able to see both lungs from top to bottom to include the costophrenic angles and the apex of the lungs. On the left side, you should be able to successfully see a heart shadow as well as an aortic arch. You should be able to see the left and right clavicle in the very top of the radiograph, equal distance from one another with absolutely no rotation. In the very bottom of every lung, you should be able to see a right and a left costophrenic angles. Key note on this is making sure that you are not clipping the very bottom of the image when you collimate so as to not clip the costophrenic angles. This is an area that is very often overseen and causes repeat exposure on this specific examination. Here we have an erect abdomen in which you should be able to see the lower portion of the right and left lung. You should also be able to see the left and right iliac crest, approximately 2 inches from the center of the image receptor. You should also be able to see an air-filled level within the stomach. And you should also be able to see a liver or the shadow thereof on the right side of the radiograph. Finally, you would be able to see in the KUB very similar structures as the previous examination, with the big difference being the way in which they are placed, because now we're laying flat. You should again be able to see the left and right iliac crest very much almost in-centered with the image receptor. You should also be able to see a full spectrum of the bladder. You should also be able to see the lumbar spine as well as the transverse processes of L4, L3, L2, possibly L1. Posteriorly, you should be able to see the coccyx in the very bottom of the image, as well as the sacrum just above the coccyx. At this point, you have successfully accomplished the acute abdominal series, and this examination is now over.